Dear student, our lecture is looks like a summary of the adrenergic system. It comes from different corners to describe the cholinergic activity. The title is Drug Affecting Neurotransmitter Release or Reuptake. Some agents act on the adrenergic neuron either to interfere with a neurotransmitter release for storage vesicles or to alter the reuptake or uptake of the neurotransmitter into the adrenergic neurons or by other way. However, due to the advantage of newer and more effective agent with a fewer side effects, these agents are seldom used therapeutically. Anyhow, it is better to know the different the basis of effect of these drugs that are used previously, but it is good to know how these medicines are work. Drug that affect noradrenaline synthesis, really only few clinically important drugs are affecting noradrenaline synthesis directly. Example are alpha methyltyrosine, which inhibits tyrosine hydroxylase, and carbidopa, a hydrazine derivative of dopa, which inhibit dopa decarboxylase and is used in the treatment of Parkinsonism. Methyl dopa, still used in treatment of hypertension during a pregnancy, is taken up by noradrenergic neurons where it is converted to a false neurotransmitter, methyl noradrenaline. This substance is not disseminated within the neuron by monoamine oxidase, so it accumulates and displaces noradrenaline from the synapse vesicle or synaptic vesicles. Alpha methyladrenaline is released in the same way as noradrenaline, but it is less active than noradrenaline on alpha 1 receptors and thus is less effective in causing vasoconstriction. On the other hand, it is more active on presynaptic alpha 2 receptor. So the autoinhibitory feedback mechanism operates more strongly than normally, so thus reducing transmitter release below the normal level. Both of these effects, as well as a central effect probably caused by the same cellular mechanism, contribute to the hypotensive action of this methyl dopa. It produces side effect typical of centrally acting anti-adrenergic drugs, example sedation, as well as carrying a risk of immune hemolytic reaction and liver toxicity. So it is now little used except for hypertension late pregnancy, where there is considerable experience of its use and no suggestion of harm to the unborn baby. Drug that affect noradrenaline storage like reserpine. Reserpine is an alkaloid which has been used in India for centuries for the treatment of mental disorder. Reserpine at very low concentration blocks the transport of noradrenaline and other amines into synaptic vesicles by blocking the vesicular monoamino transporter. Noradrenaline accumulates instead in the cytoplasm where it is degraded by monoamino oxidase. The noradrenaline content of tissue drops to a low level and sympathetic transmission is blocked. Reserpine also causes depletion of 5-hydroxytryptamine and dopamine from neurons in the brain, in which these amines are transmitters. Reserpine is now used only experimentally, but was at one time used as an antihypertensive drug. Its central effects, especially depression, which probably result from from impairment of noradrenergic and 5-hydroxytryptamine mediated transmission in the brain, where it is considered a serious problem. Drugs that affect noradrenaline release is by different methods. The first one is noradrenergic neuron blocking drug like guanidine, were first discovered in 1950 when alternatives to ganglion blocking drugs for use in the treatment was it is discovered before the discovery of ganglionic blocker. This drug it is discovered before the discovery of the alternatives that are used in as an ganglionic blocking agent. Okay, now it is understood. For the use in the treatment of hypertension were being sought. The main effect of guanidine is to inhibit the release of noradrenaline from the synaptic nerve terminals. It has little effect on the adrenal medulla and none on nerve terminals that release transmitters other than noradrenaline drug very similar to that. It include beryllium, bethanidine, and depresiquine. Actions: drug of this class reduce or abolish the response of tissue to sympathetic nerve stimulation, but do not affect or may potentiate the effect of circulating noradrenaline. The action of guanidine on noradrenergic transmission is complex. it is selectively accumulated by noradrenergic nerve terminals, being a substrate for NET. Its initial blocking activity is due to block of impulse conduction in the nerve terminals that selectively accumulate the drug. Its action is prevented by drugs such as tricyclic antidepressant that block NET. Guanidine is also concentrated in synaptic vesicles by means of the vesicular transporter VM80, discussed previously in the previous lectures, possibly transferred with their ability to undergo exocytosis and also displacing noradrenaline in this way. It causes a gradual and long-lasting depletion of noradrenaline and synaptic nerve ending, similar to the effect of reserpine. Now let's come to the indirectly acting sympathomimetic amine, the most important drug in the indirectly acting sympathomimetic amine category are tyramine, amphetamine, and ephedrine, which is discussed previously also. Let us repeat a little bit to maybe more and more understand very well which are structurally related to the noradrenaline. Drugs that are similarly and are used for their central effect include methylphenidate and atomoxetine. These drugs have only weak actions on adrenal receptors but sufficiently resemble noradrenaline to be transported into nerve terminals by NET. Once inside the nerve terminals, they are taken up into the vesicles by VM80 in exchange for noradrenaline, which escapes into the cytosol. Some of the cytosolic noradrenaline is degraded by MAO, while the rest escapes via NET in exchange for the foreign monoamine to act on postsynaptic receptors as in figure 1. Exocytosis is not involved in the release process, so their action do not require the presence of calcium. They are not completely specific in their action and act partly by a direct effect on adrenal receptors, partly by inhibiting NET, thereby enhancing the effect of the released noradrenaline, and partly by inhibiting monoamino oxidase. Sorry. Yes. Now let's come. Please always refer to the tables that help you in the understanding what we say. These are two very important tables and it may give you full understanding about what we say. As would be expected, the effect of these drugs are strongly influenced by other drugs that modify noradrenergic transmission. Thus, reserpine and 6-hydroxydopamine abolish their effect by depleting the terminal noradrenaline monoamine oxidase inhibitor. On the other hand, strongly potentiate their effect by preventing inactivation within the terminals of the transmitters displaced from the vesicles. Monoamine oxidase inhibition particularly enhances the action of tyramine because this substance is itself a substrate for a monoamine oxidase. Normally, dietary tyramine is destroyed by monoamine oxidase in the gut wall by liver before reaching the systemic circulation. When monoamine oxidase is inhibited, this is prevented and ingested of tyramine-rich food such as fermented cheese can then provoke a sudden and dangerous rise in blood pressure. Inhibition of NET such as imipramine therefore interfere with the effect of indirectly acting sympathomimetiquimine by preventing their uptake into the nerve terminals. These drugs, especially amphetamine, have important effect on the central nervous system that depend on their ability to release not only noradrenaline but also 5-hydroxytryptamine and dopamine, as we said, from nerve terminals in the brain. An important characteristic of the effect of indirectly acting sympathomimetiquimine is that marked tolerance develop. Repeated doses of amphetamine or tyramine, for example, produce progressively smaller process responses. This is probably caused by a depletion of the releasable store of noradrenaline. A similar tolerance to the central effect also develop with repeated administration, contributing to the liability of amphetamine and related drugs to cause dependence. So there is a similar tolerance to the central effect also developed with the repeated administration, contributing to the liability of amphetamine and related drugs to cause dependence. Why? Because they are cause a secretion of adrenaline and 5-hydroxytryptamine or dopamine from nerve terminals, and the repeated use may cause dependence. The peripheral action of the indirectly acting sympathomimetiquimine include bronchodilation, raised arterial pressure, peripheral vasoconstriction, increased heart rate and force, myocardial contraction, inhibition of gut motility. They have important central action which account for their significant abuse potential and for their limited therapeutic application apart from ephedrine, which is still sometimes used as a nasal decongestant because of its much less central action. These drugs are no longer used for their Peripheral sympathomimetic effects. Inhibitors of noradrenaline reuptake of released noradrenaline by net is the most important mechanism by which its action is brought to an end. Many drugs inhibit net and thereby enhance the effect of both synaptic nerve activity and circulating noradrenaline. Net is not responsible for clearing circulating adrenaline, so that drug do not affect response to this amine. The main class of drug whose primary acting is inhibition of net are the tricyclic antidepressant, for example, imipramine. These drugs have their major effect on the central nervous system, but also cause tachycardia and cardiac dysarrhythmia, reflecting their peripheral effect on sympathetic transmission. Cocaine, known mainly for its abuse liability and local anesthetic activity, enhances sympathetic transmission, causing tachycardia and increase arterial pressure and the chronic use cardiomyopathy and cardiac hypertrophy. Its central effect is euphoria, and excitement are probably a manifestation of the same mechanism acting in the brain. It strongly potentiates the action of noradrenaline in experimental animal or in isolated tissue, provided the sympathetic nerve terminal are intact. The main site of action of drugs that affect adrenergic transmission are summarized in figure 2. This is a very clear figure that you can use it or show it to see the discussion and have a clear idea about what we discussed. Thank you.